Most people think the glute bridge is too simple to matter. It looks too easy. No equipment, no load, just lying on your back, lifting your hips. But the research on doing this every day for 30 days tells a different story. Daily glute bridges build glute activation, hip extension strength, and spinal support in ways that compare favorably to far more complicated lower body exercises. Hip bridges are gentle enough to do every single day without overloading your joints or your lower back. Here's a simple way to check which category you fall into right now. Lie on your back, knees bent, feet hip-width apart, heels 6 to 12 inches from your hips. Drive through your heels to lift your hips into a bridge and hold for 2 to 3 seconds. Pay attention to where you feel the effort most. If it is mainly your glutes and your lower back feels supported, you are already glute dominant. If your hamstrings cramp or burn more, you are hamstring dominant. If you feel tension creeping into your lower back, you are compensating from the spine instead of the hips. This matters because most lower back pain in desk workers comes from exactly that compensation pattern. Weak glutes shift the load to muscles that were never built to carry it. The research backs this up clearly. A combination of stabilization work and glute strengthening, including bridge variations, reduced low back pain and increased lumbar strength more than stabilization work alone. Several reviews described glute bridge progressions as among the most effective single exercises for long-term low back relief over an 8-week window. Here is what a 30-day progression looks like. Days 1 through 10 focus on activation and patterning. 3 sets of 10 to 15 basic bridges. Slow tempo, a 2-second hold at the top. The cue to remember is heels heavy, ribs down, squeeze your glutes at the top. Days 11 through 20 build endurance and symmetry. Increase to 3 to 4 sets of 15 to 20 reps and add isometric holds of 20 to 30 seconds. This is also where you introduce the marching bridge, lifting 1 foot at a time while keeping your pelvis level. Days 21 through 30 shift to unilateral control. Single leg bridges, 3 sets of 8 to 12 reps per leg. This is where most people notice the biggest change. The side that used to feel weaker starts holding steady, and your hip extension becomes something you control rather than something that just happens. By day 30, the test changes completely. The same bridge that once lit up your lower back now feels like it belongs in your glutes. Stairs feel easier. Morning stiffness fades. Sitting and standing transitions feel more controlled. One safety note: if you have had a recent disc injury, spinal surgery, or hip replacement, get clearance from a physio or doctor before starting. And pain during the exercise should always be a stop signal, not something to push through. The glute bridge will never look impressive on camera, but for spinal support, posture, and daily low back relief, 30 days of consistency may do more than any single exercise you have tried. Train smarter, not harder. Thanks for watching.